Hi, this is Irene Owens, and this is part 2 of the nursing process, and this will be, I'll be going over Chapter 3 in Wilkinson, and this is on assessment. The nursing process assessment definition is a systematic gathering of information related to the physical, mental, spiritual, socioeconomic, and cultural status of an individual, group, or community. The assessment includes gathering of data using a systematic and ongoing process, categorizing the data, and recording that data. So when we go in, we look at and we use all of our nursing tools and our skills of inspection, palpation, auscultation. So we gather all that data from what the patient says to us. Gathering data also includes the subjective and objective data. That's real important for you to know the difference. Remembering that subjective data is what the patient states to you, and objective data is all the other information that you gather on your own. These next two slides just go over the relationship to the other steps of the nursing process, the diagnosis, the planning outcomes and interventions, the implementation, and the evaluation. So when we gather this data, how is this data used? It's used by other disciplines in collaborating care. It's to plan for your nursing care, because your nursing care needs to be organized, and it needs to be systematic, and it needs to be outcome based, which the nursing process is. It's also to ensure clients receive proper care and by qualified individuals at the time that they need that care. So you ask, what's the difference between a medical diagnosis or a medical assessment and a nursing assessment? Just remember that medical assessments focus on disease and pathology, whereas nursing assessments focus on the client's response to the illness. So when you have a patient that comes in, the patient's diagnosis, medical diagnosis may be pneumonia. However, the nursing assessment will be, all of the nursing assessments will be based on the client's response to that illness of pneumonia, such as if the patient has a fever, if the patient is short of breath, if the patient's O2 sat is low. So that's basically the difference. So if you can kind of keep that in mind, especially when we get into medical diagnoses versus nursing diagnoses, because it gets a little bit confusing there. Remember, it's always the response to the illness. We can't talk about assessments without asking ourselves, can I delegate assessments? And the ANA's Code of Ethics for Nurses, Provision 4 in 2001 states that the nurse determines the appropriate delegation of tasks consistent with the nurse's obligation to provide optimum patient care. So if, I reread that for you because I think, you have and I have a moral obligation to provide optimum patient care. Assessment is our tool in order to give that excellent patient care. And can I delegate assessments? No. The answer is no. It is up to you as the nurse to do your own assessments. Here's some resources to guide nurses in delegating. The State Nurse Practice Act's agency policies and procedures that are in our hospitals, accrediting agencies such as JCAHO and the American Nurse Association as well. These are the different types of assessments that you may be doing. There's the initial assessment, and that's usually when the patient first comes into the hospital. And when you do that assessment, that initial assessment, you're doing a comprehensive assessment at that time, because that's a very global assessment, and it provides that holistic information about the client's overall health status. Ongoing is when the patient's already there and you're doing your 12-hour, because it's mandatory at the hospitals, every 12 hours assessment needs to be done. So that's an ongoing assessment. Then we have our focused assessment, and I look at this more like an ER assessment. They go in, get the facts of what happened to the patient, and then they're out. And then there's the special needs assessment, which we do all the time, especially our pain assessment and nutritional assessments, our functional assessments, and psychosocial assessments as well, and we'll go over some of those in a later slide. There's also when you have that source of data that you're going to gather, we talked about the subjective data and we talked about the objective data. Just remember that subjective is the information that's communicated to the nurse by the client, the family, or the community. And objective data is data that was gathered through a physical assessment or from labs or diagnostic tests. Also, you can have primary versus secondary information or data that you gather, and primary comes from what the client says or what you have observed. Secondary data are obtained secondhand, usually from the medical record or from another caregiver, such as the husband or the wife. This is what they call a little clicker check, and the clicker check is if we were in class, we would have little clickers, and we could all click the right answer, and we'd all see it in a graph kind of form. So since this is online, this is kind of a fun thing to do. The nurse is completing a head-to-toe assessment on her client at the beginning of the shift for the hospital unit. This would be considered a focused assessment, initial assessment, ongoing assessment, or a special needs assessment. And hopefully you got the answer right. I think I lost our place here. Let me go back. I think you're okay. It's just me. Alrighty, there we go. And the correct answer is C. This type of assessment can be completed at any time after the initial assessment. Gathering data at the beginning of a shift will enable the nurse to more effectively evaluate how to proceed with the plan of care for the shift. So hopefully you got it right. These are just some of the examples of the special needs assessment that we talked about earlier. And the next slide goes over basically what a comprehensive assessment consists of. Complete nursing history, a physical exam, and it contains that subjective and objective data that's very important. Our basic physical assessment techniques: inspection, palpation, percussion, and auscultation. I think one of the videos has a head-to-toe assessment in it from YouTube that you can go over, and I think also your videos, your skills videos with Wilkinson will have some basic physical assessment techniques. We're going to be going over those, so it would be nice if you kind of reviewed those to begin with. And we'll go over those more in depth on Thursday and on our skills fairs. The nursing interview is very important because it should be purposeful, it should be structured, it involves questioning the client, and the purpose is to gather that subjective and objective data, from the patient for that nursing database. Directive interviewing, this is basically to obtain factual, easily categorized information. Directive interviewing is usually directed by the nurse, just to get, a lot of times it's just to get those yes and no answers really quick. The non-directive interviewing allows the client to control the subject matter, and it's usually like in a clinic setting. That's kind of the way that I interview patients is more non-directive, unless there's something that is really pressing with that client that comes in, and that the client may have to go to the ER. So it just depends on what's going on with that patient, and you know that right away when you do your very first technique for assessment. In that observation time. So preparing for the interview, you should know the purpose of it and how the data will be used, and read the client's chart before you go in. Form some goals for yourself always and for the client, and some opening questions. Schedule uninterrupted time, Have your forms and equipment ready, and compose yourself before entering the room. And most of y'all feel pretty comfortable with that at this point in your practice. Preparing the space, always provide privacy, remove distractions, and always sit at the same level as your client. And do not hover over the bed, do not hover over them. It's amazing all the research that's been done about physicians that come in, and if they sit and talk to the patient right at eye level, the patients always perceive that they stay longer than if they hover over the bed and look down on them. Always prepare the client. You introduce yourself. You call the client by their last name. You give them full respect until they tell you otherwise. Tell the client what you will be doing and how come. Assess for readiness to discuss those health issues, because if they're not ready and they're in pain, you're not going to get anywhere. Assess and provide for comfort, and assess for any anxiety. I see you can maybe ask them, or just state a fact that I see that you're a little uncomfortable with what we're talking about, or I see that you're anxious. And they may say, yes, I'm very anxious, or they may say, no, you're crazy. But, that's okay. As long as you try to validate, and we're going to talk about validation of how the client is feeling. So when we conduct the interview, we want to individualize the approach, use active listening, pay attention to those nonverbal communication. You use mostly open-ended questions. You avoid healthcare jargon. You try to curb your curiosity, especially because you want to be curious, but you don't want to be so curious that it's like, oh my goodness, that you're going to exhaust the patient, and it's some of the personal stuff you don't really need to know. Do not give advice or voice approval or disapproval. Every now and then you're going to hear, especially since I record from home, I have two boxers, as you can hear in the background, and they don't like when people come around the house. So my one big boxer is outside right now, and he's barking. So I just wanted you to know that there's nobody coming in the house at me. He's probably barking at a squirrel, so never fear. Okay, here's one of our next clicker check, and this is which action by the nurse might be a barrier to obtaining complete and reliable information from an interview with the client. A is noting that the client's body language indicates that he or she is fatigued. B, maintaining eye contact with the client if it is not culturally inappropriate to do so. C, carefully guiding the conversation so that important topics are discussed. And D, asking the client directly, why are you not taking your insulin? And the answer is D. During the client interview, avoid asking any kind of why questions. Not only do they suggest disapproval, but also many clients do not know why they do or do not comply with therapy. Okay, good. So as we go into the last slides of this section, we always want, and I talked about this earlier, we want to validate our data. And when do you validate? Well, you validate when there is a discrepancy between the subjective and objective data. They don't make sense to you, such as a patient that has had blood pressure, a high blood pressure. The tech comes and tells you that, and you look back, you look at the record of when he first came in, he's never had high blood pressure. So you want to validate that because it just doesn't make sense to you. And maybe that blood pressure is high, and you need to validate that as well. Client statements differ at different times in the interview. Sometimes we have to reel our patients back in and say, I thought I heard you say, and just kind of validate whether that's right or that's wrong. Also, we want, anytime you want to validate data is when data is far outside the normal range, and any factors that are present that may interfere with any kind of accurate measurement, such as a blood pressure cuff may be too big or too small, or maybe they just drank something hot, and or maybe there's faulty equipment. So you always have to make sure that you check everything before you make a decision on that. Okay, so we're going to go back. I kind of got ahead of myself in here, so I think we were at documenting data. Document as soon as possible. Make sure that you write legibly. Avoid using any kind of inferences because we want to have just the facts. Use the client's own words, and usually we quote those. Record only pertinent, important, and relevant data, which is real important as you document, because as you know, if it's not documented, it's not done. I love how at the very end of chapter 3, on page 53, it's reflecting critically about assessment. And I think that as an RN, you need to always be reflecting on how your day went, how you could have done it different as you evaluate your patient care, you evaluate the circumstances of the day. And these have some wonderful questions in it about how your data is, if it's complete, if it's accurate, if it's validated. Did I record the data and not the conclusions or any inferences? Did I follow up with any special needs? Did I think about the client interview? And did I review the physical assessment? Did I miss something in the environment? How did the client and significant others respond to me, both verbally and non-verbally? Did I pay attention to detail? And were my assessment techniques performed skillfully? Those are all things that we need to ask ourselves. So if you would go over page 53. This is the end of part 2 and nursing process assessment. As you review for your opportunity to succeed, it's always important that especially in assessment, that you look at the difference between subjective and objective data. Very important. You're going to be asked different questions based on client interviews. So you're going to have to have some working knowledge on what you're going to ask first, what's the most important based on a scenario. So good luck, and we'll talk to you shortly. Thanks.